Here's your host, Chelsea Edwards.
Welcome to another episode of Chattin with Chelsea. I'm your daytime bestie, Chelsea Edwards. Friend, have you been feeling stressed, maybe sluggish, a little puffy around the edges? Yeah, well, I got your problem all figured out right here. See, what you need to do is drain your lymphs. You gotta get in there, get somebody who can really get in there and drain those lymphs for you, because you got some doohickeys, some toxic metal thingamajiggers in there. You got to get somebody to clean those out, get your invigoration back in you. Yeah, it's nothing quite like a drained lymph, I tell you.
Well, Chelsea, actually, those are called lymph nodes. Let's talk about it.
Oh, okay. Hi, what are you, some kind of doctor or something?
Nice to meet you. I'm Dr. Preethi Prasad. I'm a medical oncologist and hematologist. I work at Methodist West.
All right, nice to meet you, Dr. Prasad. Thank you for coming on Chattin with Chelsea.
Pleasure.
Okay, so what is a lymph node? I guess I've heard that term before, but what does it mean?
So lymph nodes are actually all over your body.
Okay.
They're these bean-shaped structures that are located in your neck, in your armpit area, in the groin. There's also several internal lymph nodes that are not necessarily something that we can feel.
Okay.
So the lymph nodes in general are essentially the cornerstone of the immune system. So the lymph nodes have lymphocytes within them. Lymphocytes are white blood cells that help battle infections as well as other abnormalities within your body.
Okay, so we've got them all over our body and they help keep us healthy.
Yeah.
Okay, can we say that they filter out some things? Is that kind of what they do?
Absolutely.
Okay.
So lymph is the name of the fluid that essentially travels throughout. It typically has water, protein, germs. So then think of it as kind of like a highway. Like the lymphatic vessels are carrying this lymph throughout, and then they stop at the lymph nodes that have all the lymphocytes, and then the lymph just kind of keeps traveling through.
Okay, so there is a term, lymph, that we use.
Yeah, no, that's accurate.
You're
actually.
Like, kind of, yeah, we're just about it. I'm learning.
Yeah.
So I started hearing about lymph nodes really because people would get plastic surgery, and then the aftercare would be you'd have to get your lymph nodes drained, get that massaged, but they sound like they affect all of us regardless of our status on plastic surgery.
So when we're thinking about what lymph nodes are typically doing, when you do have like a cold, for example, you often will see lymph node swelling. And that's not actually abnormal. So if you have a little bit of, like, for example, a bad cold, a virus, or any type of bacterial infection, you can get pretty commonly some type of lymph node swelling within the neck.
Okay, so right here,
right
okay,
here.
when they're checking here to see if you're when the doctor is feeling right here.
That's to look for lymph nodes.
To see if they're swollen.
Exactly.
Okay, all right, and so it's normal for these to swell. Is it
temporarily?
Temporarily,
yeah.
Okay.
So you can see maybe what we would refer to as like an intermittent swelling in the setting of a cold. So you would get like a little bit of swelling, and then as the cold resolves, we would expect it to go away.
Okay.
So the big issue ends up becoming if it's more than 3 to 4 weeks of swelling, that's when you need to get it evaluated. Or if there's something that's rapidly enlarging, then that's kind of more of a red flag.
Now, what if the ones in the armpits are swollen?
So when we're thinking about where the different lymph nodes typically react to different things, so for example, if you had some type of soft tissue infection or something related to a razor, it could affect your armpit lymph node.
Oh, like an infection with the
Like an
razor?
infection could do it as well, or like
okay.
a folliculitis, like a hair inflammation.
Got it.
But it's basically like the chronicity, like the longer that something is there, and if it starts to become larger and larger and it's kind of like firm to the touch, that's when you start to worry.
Okay.
So when we're thinking about like the worrisome things, it's you can get cancer within the lymph node, and it could either be like a primary lymph node cancer, like a lymphoma, meaning that it starts from the lymph node.
Oh, wow. So I have heard of that term, like Leukemia Lymphoma Society. That's what they're referring to.
Right,
lymphoma. Okay, lymphoma. Yeah. Okay, so if this is particular to the armpits, but what about the other parts as well?
So, you know, overall, when we're thinking about lymph nodes within the armpit, I would say it's most correlated to some degree like with breast cancer. So if it's like a persistent lymph node that's growing that does fit that, you know, kind of like the red flag criteria. So breast cancer, when it is going to spread, does often spread to the lymph node in the axilla.
Okay, all right. And you said there are also lymph nodes in our growing.
Yeah, so there's lymph nodes in the, you know, obviously right here in the neck, in the armpit area, in the groin. So it's essentially, depending on where it's located, it could be like if you have some other type of cancer, like in that particular area, if it's like a colon cancer, it could spread to the lymph nodes within the groin, for example.
Okay.
Or if it's like a ovarian cancer, for example, it could also spread there. So it just depends on where your organs are in the body and where exactly the lymph nodes are that it could indicate spread from one of the other cancers.
Yeah, like our clue that something could be going on.
Right.
Got it.
But the important thing is still, you know, because the lymph nodes do play such an integral role within your immune system, that a lot of lymph node swelling is actually okay.
So even if your lymph nodes in other parts of the body are swollen, it could be temporary.
It could be temporary, it could go away.
Okay, got it. All right. Thanks for clearing that up.
Yeah, no, definitely.
But I have so many more questions. We're going to take a quick commercial break, you guys, and we'll be back and learn more about our lymphs. Our lymph nodes. Say it for me.
Lymph nodes.
Lymph nodes. That's what it is. We'll be right back. It's time to get our lymph nodes together. We're back with Dr. Prasad of Houston Methodist West. Okay, so you have broken down what the lymph nodes do, and they help keep our immune system in order, essentially help filter out some things, and they're in different parts of our bodies. Now, you mentioned if they're swollen, that could be a sign of something, but what if there's something wrong with our lymph nodes and we can't see it, like it's not visible to our eyes that there's an issue?
Yeah, so that's definitely something that can happen because of the fact that so many of the lymph nodes are actually internal. So there's some that we can actually feel or that your doctor can feel on exam, but yeah, there's definitely a lot of internal lymph nodes where it's kind of only something that could be picked up on a scan. So when thinking about, you know, some type of lymph node issue in the context of something that's not really visible, there are some big red flag symptoms to be aware of.
Okay.
So when we're thinking about lymphoma in general, lymphoma symptoms are what we refer to as the B symptoms. So those B symptoms are if you're having, you know, high unexplained fevers, unintentional weight loss, or night sweats. Those are kind of like the big three.
Okay.
Similarly, kind of within that overall umbrella, if you're having severe fatigue that's unexplained, for example.
Okay. All right. So that is something that I've heard about. Okay, your lymph nodes might not be in order if you're really sluggish and tired.
Right.
Okay. So great red flags to look out for. Now you mentioned lymphoma.
Lymphoma.
Okay.
Yeah.
And then I've heard of lymphedema.
Right.
Okay. What is the difference between those two?
So lymphoma is an actual type of cancer.
Okay.
So it's a cancer of the lymph nodes, and lymphoma is actually a pretty heterogeneous type of, I mean, there's actually several different types of lymphomas. There's Hodgkin's lymphoma, and there's also non-Hodgkin's lymphoma.
Okay.
So there's a lot of different types. It is going to be a primary cancer of the lymph node.
How does that present itself typically?
So the typical presentation is actually some type of lymph node swelling, or it's kind of one of those B symptoms.
Okay, got it.
So part of the process to screen for it or to be aware of it is just kind of obviously being aware of what your baseline looks like, what your normal is, and if there's something that seems to be deviating from that normal, it's always good to get it checked out.
Okay, and then lymphedema.
So lymphedema is not malignant, so it's not cancerous.
Okay.
So it can actually follow a lot of surgeries that are done for cancer. So, but in and of itself, it's not actually a type of cancer.
And how does that present? What does lymphedema look like?
So lymphedema, what we see often is we see lymphedema of one of the arms, so one of the upper extremities, and it's typically after breast cancer surgery.
Wow.
So what ends up happening with breast cancer surgery is the mass within, or a tumor within the breast is removed by the surgeon, and then they also end up sampling the lymph nodes to see if there's any spread of the cancer to the lymph nodes.
Oh, okay.
So they're pretty much sampling the those lymph nodes within the armpit, which are called the axillary lymph nodes. So typically, the side in which you are going to potentially get the swelling is going to be the same side where they actually did the surgery.
Okay. So it's essentially the swelling.
Right. So
Happening.
if
Okay.
you think about it this way, and this kind of goes back to what we were talking about earlier with the lymph and the lymph nodes and kind of like that highway system of the travel of the lymph. So if you're essentially removing lymph nodes, and sometimes it ends up being a pretty high number of lymph nodes that are removed, like it could be, for example, up to 12 lymph nodes that are removed with a surgery.
Oh, wow. Okay.
So in the context of removing all of those lymph nodes, you're basically getting rid of one route for the lymph to really go through. So then that particular fluid then ends up backing up, and that's where you get the lymphedema.
In the swelling. Got it. All right. So speaking of swelling, I mentioned that I've seen people get their lymph nodes drained. That's what they call it, right? Getting these massages specifically after having plastic surgery, like getting a BBL or getting like breast augmentation. Why do you think they need to get that done or do that after?
So I would say that maybe it's potentially like with the instrumentation from the surgery, with the BBLs or with breast augmentation, that there could be maybe some asymmetry, like maybe one part of the body is a little bit more swollen than the other. So the plastic surgeon then might recommend, you know, using the drainage massage as a way to kind of just like help the fluid circulate through.
Okay.
Because, you know, anytime you're going under the knife for anything, those lymphatic vessels are basically all over your body. So there's like that chance to have some type of disruption.
Okay.
Yeah.
Is there anything that we could be doing to make sure that our lymph nodes stay healthy?
Yeah, so it's just basically what you would associate with being healthy overall.
Okay.
So, you know, the big things are to, you know, eat a healthy diet, eat lots of colors with your diet, drinking a lot of water. So if you think about the fact that so much of the body is water, you know, with the lymph, with the blood and everything else, like drinking water helps your immune system function correctly.
Okay, so keep it flowing.
Keep it flowing, yeah, pretty much.
That's a good visual. Keep it flowing, drink your water, eat your veggies.
And definitely, I mean, in the same vein of, you know, keep it flowing, keep moving in general. So the more active you are, the more circulation you're going to get of the lymph.
Nice. All right, yeah, let's keep those guys flowing. Okay. All right. Thank you so much for answering my many burning questions about lymph nodes. All right, guys, we're going to take a quick break. And when we come back, I take a visit to get my lymph nodes drained. We'll see how it turns out. Okay. Be right back. Now that we've learned all about lymph nodes, we get to dig a little deeper. They say this place has the best lymphatic treatment on the market. So of course I had to try it for myself. We popped into the Ozone Bar's brand new Houston location for a massage experience like I've never had before.
Welcome to the Ozone Bar.
Thank you.
So fun to meet you.
So excited. Yes. So I hear you got some things that'll help me like feel good, get my body together,
Yes.
get me feeling right.
Absolutely. We have you set today for the DermaShape, which is our #1 treatment, and the Hocket, which is a Lamborghini of all. So you will be happy.
Okay, let's do
Okay,
it.
ready?
Yes.
Okay. So Here we are. This is our ozone sauna.
Oh, wow.
This is what we are known for.
Okay.
And what ozone is, it's activated oxygen. So it's actually O2, which is the machine, the oxygen tank, being converted into O3. And while you're sitting inside, you're transdermally absorbing it through your skin.
Wow, so I'm going to be inside this.
You're going to be inside.
Okay.
Your head will be sticking out. We also have the infrared sauna.
Okay.
And people love it. You're actually sitting inside, contained in this box. There's actually now data to support that if you do any type of sauna for a minimum of 20 minutes, 3 times a week, you reduce your risk of heart attack and stroke by 53%.
What?
Yes, so now we're gonna have you go into the lymphatic treatment room, which is our dermashave.
Okay, so I've heard of these lymphatic treatments.
Yes.
But what is it all about? Like, it's just a craze.
It is the craze, the hype, and all the rage right now. So having a healthy lymphatic system is really crucial and key for good health, overall good health.
Okay.
So what sets us aside with our machine, which is called the dermashave, it's breaking up fascia and lactic acid. It really is amazing for water retention and bloating. And the icing on the cake is the girls love it because it really helps with cellulite. So I'll have you get undressed. We'll leave the room and let you have some privacy. Grab one of those towels, and then you'll just be face up on the table.
Time to get naked.
So how we feel? You good?
Yeah, I'm
Okay,
comfy.
perfect. This is Gina, and she will be demonstrating the dermashave. Feels a little spicy, huh?
Yeah, like I'm just getting sucked up my leg.
Basically.
Okay.
So what's happening right now is like major tissue manipulation. So you can see by the lifting of the machine that it's getting 4 layers deep. So this is way more than just an actual manual massage.
So who typically comes in for these? Are we talking athletes or just like?
You'd be surprised, we do have a pretty strong male clientele for the dermashave. I'd say 90% are female. But we do have 10% that the men absolutely love it too because they're seeing a lot of help with muscle recovery and tension. I do have several plastic surgeons that are referring to us after post-op for mommy makeovers, tummy tucks, things of that nature because it's getting blood flow to the area, you can tell. And you know, getting blood flow to the area really helps break up the scar tissue.
So for pain management,
Right.
what types of clients are you getting in? Do they have certain conditions?
I have a lot of clients with autoimmune disorders, you know, lymphedema, because they're swelling and they're having pain and, you know, not able to put their shoes on. And, you know, so this treatment has really been great, like for results for those clients.
How often should people get these treatments?
It depends on what your health goals are and what your actual goals are. So for people that are really wanting to do it for their overall health and for, you know, lymphatic treatment, they usually are doing it, you know, twice a month is a great start. How was it?
Oh, it was great. I mean, I felt pressure where I was tender,
Right.
but the rest of it just felt like somebody kissing me
Aw,
all over.
that's great.
Maybe
Yeah.
a little aggressively. Like,
Right.
they really
it
like
does,
me.
It gets pretty deep, but it's really amazing for you.
Yes, and I had a question because I got up and lifted up my arms and saw this.
Ooh, I love that.
What is this?
That is an example of perfect example of toxins. That's like instant gratification.
Nice.
You're sweating out arsenic, mercury, uranium, plastic, like all things in the environment, pollution in the air. Like that is a great sign to have that, especially on the first time.
Yay!
Okay, that's amazing. So next up, we are going to put you in the Hocket. This is the ultimate sweat sesh. This is amazing for your health. So many benefits. Ultimately, this is the equivalent of doing 10 ozone saunas in one session.
Whoa! Well,
Yeah,
let me
so-
get on in.
Ready to start?
Yes.
Okay, perfect. You will feel a little tingling sensation on your feet.
Oh, yes, I feel it.
Right now, you are being infused with O2, O3, and carbonic acid. So ultimate detox today.
I retoxed yesterday,
Yes.
so I'll detox
I love
today.
it. I love that. Detox to retox. That's our motto. I love it.
Yay, all done.
How was it?
Oh my gosh, I feel oddly lighter,
Yes.
maybe even younger.
I love
I don't know
it.
what it is.
Well, this afternoon you should just hydrate, drink plenty of water. You should have a boost of energy this afternoon and sleep like a baby tonight.
Looking forward to that.
So is this Chelsea approved?
Yes, it is Chelsea
Okay,
approved.
perfect.
I really did feel looser and lighter. All right, you guys, go ahead and grab some water, hydrate those lymph nodes, and we'll be right back after this. Thank you for watching this episode of Chattin' with Chelsea. Dr. Prasad, how would you sum up the lymph nodes for everybody who's been watching this episode?
Yeah, absolutely. So in summary, lymph nodes, again, a very important part of your immune system because they house your white blood cells to fight infections as well as other abnormalities within your body. So lymph nodes, as a normal part of your body, can swell up when you have infections or colds, for example. And the big thing to keep in mind is if there's a swelling that is ongoing for longer than 4 weeks, or if there's a lymph node that's rapidly enlarging, that you do need to seek out medical care.
Okay, are we going to our doctor or our dermatologist if we see like a hump?
You can just go to your PCP for that.
Okay, primary care.
Primary care would be fine. And as with anything else, if you feel a lump within the breast, that needs to get checked out right away because that would be suspicious for a primary breast cancer. And I think in summary, obviously it's October, it's Breast Cancer Awareness Month, so everyone should make sure to get their mammograms.
Okay, all right, make sure you get checked, all right?
Yeah.
Okay, thank you so much for breaking all of that down for us. You guys can keep up with us on social at Chelsea Show Fox, and we'll see you on the next Chattin' with Chelsea.